All right, everyone, this is Ken Klippenstein with TYTI Investigates. I'm here to talk to you about what I believe is an outrageous scandal, which is the shortage of insulin, or at least ability to access insulin on the part of millions of Americans in the United States, which has resulted, as the title of this video suggests, in huge numbers of them rationing it. They're rationing something they need to live day to day. What I found here by a survey conducted earlier this year by a nonprofit group called T1 International was that 26% of people with type 1 diabetes in the United States have rationed their insulin in the past year. In the past year, that represents, at least hundreds of thousands, maybe millions of people that are doing something that you would think you might see in Venezuela or North Korea or, some poor country, but this is happening in the richest country on the planet with also a lot of the best pharmaceutical companies and medical expertise. That to me is absolutely outrageous, especially in light of how cheap insulin actually is. So when you see a quarter of people, according to the study, with diabetes or type 1 diabetes are rationing it, you might think, well, that must be a really scarce commodity. That must be expensive. No, it's not. I looked at a report by BMJ Global Health. It was a study they conducted where they found that the actual cost to produce insulin is it's like $5 or so. So the cost to make, it's not a matter of it just costs so much that they have to make a little bit of a profit. They're just price gouging to an insane degree, and it's literally killing people. And I'm going to give you guys a couple examples of that here that make my blood boil, and I hope it makes you guys mad too, because none of the folks dying from this this is not some kind of extraordinarily rare treatment or medication that they're just, isn't any way to get around the cost. So here's one example. It was reported in NBC's Minnesota affiliate. The 26-year-old by the name of Jesy Scherer-Radcliff, he died rationing insulin, according to his family, who said that he just could not, afford it. And when you try to ration it, you can't always anticipate, what your blood sugar levels are going to be, and that invariably leads to, some number of people are going to die because of it. And what I found really interesting about this story, in addition to really heartbreaking, is the fact that another mother of a person who died recently, her name is Nicole Smith Holt. Her son Alec died at 26, also rationing insulin. He died 1 month after losing his healthcare coverage. And so if you don't need a clear example of how the lack of healthcare coverage in this country is literally killing people, here's one. She said of this other kid that just died, Jesy, she said, quote, "My son and Jesy, they were murdered. They were killed by Big Pharma. The cause of death should actually be on their death certificates. Corporate greed. I want justice for all of their deaths." That's a direct quote from the mother of another person, another young man who died due to rationing insulin. So, we kind of got to ask ourselves, why is this happening if it's so cheap? If, I can't imagine any ordinary person in the public doesn't want diabetics to get the care they need to not die. Why is it happening? Well, the pharmaceutical companies make a huge amount of money by literally just price gouging. I mean, I don't even know if price gouging gets that. You could call this extortion, because if you don't pay it, you're dead. It's almost like the mafia. You got to pay me your protection money. Well, the person asks, well, who do I need the protection from? The mob boss says, from me.